Hello and welcome back to HBB, Strictly Education. So today we are going to continue with part 2 of why the rise of erectile dysfunction in younger men. Several types of medications can potentially cause or contribute to erectile dysfunction. Antihypertensives, which is blood pressure medication, beta blockers, diuretics, ACE inhibitors, antidepressants, selective serotonin reuptake inhibitors, tricyclics, antipsychotic treatments, first generation antipsychotics, some second generation antipsychotics, antiandrogens, which are used in prostate cancer. So these are medications, some medications that can cause ED. And if you are on these medications, it's best to talk to your doctor about dosage. Maybe you can lower your dosage, but you need to talk to your doctor. These are more things that can cause erectile dysfunction. And we have the 5-alpha reductase inhibitors used for benign prostatic hyperplasia and hair loss, finasteride. Now, these medications, and I have to tell men, these medications that you use, if you're getting something from the doctor that's a medication to grow hair back, you need to read the side effects because most of them will cause ED. It will cause a problem. Anti-convulsant drugs, medications used for seizures or nerve pain, chemotherapy drugs, and some recreational drugs, alcohol, especially with chronic use, marijuana, cocaine, and opioids. We're going to talk about marijuana, which is probably going to set some people back. Antihistamines, particularly first generation antihistamines, hormone therapies, and drugs that alter testosterone levels. These things will cause, they can potentially cause erectile dysfunction. While the relationship between marijuana use and erectile dysfunction is complex and not fully understood, there is some evidence suggesting that marijuana can potentially contribute to ED in some users. Here's an explanation of how marijuana might affect erectile dysfunction. Hormonal effects. Some studies suggest that long-term marijuana use may lower testosterone levels in men. Testosterone is crucial for maintaining libido and erectile function. Cardiovascular effects. Marijuana can cause an increase in heart rate and change in blood pressure. These cardiovascular effects could potentially impact blood flow, which is essentially for achieving and maintaining an erection. Psychological factors. Marijuana can affect mood, motivation, and cognitive function. For some users, this might lead to reduced sexual desire or increased anxiety about sexual performance, indirectly contributing to ED. Wow. Dose-dependent effects. The impact of marijuana on sexual functions may be dose-dependent. Some users report enhanced sexual experiences with low dosage, while higher dosage or chronic use may be more likely to cause issues. Individual variations. The effect of marijuana on erectile functions can vary significantly between individuals based on factors like frequency of use, the dosage, method of consumption, and personal physiology. Several strategies can help mitigate the risk of erectile dysfunction. Discuss your concerns openly with your healthcare provider. That's one. They may be able to adjust the dosage or switch you to an alternative medication with less impact on sexual function. Timing of medication. In some cases, changing when you take the medication relative to sexual activity may help. Lifestyle modifications. Regular exercise can improve overall cardiovascular health and blood flow. Maintaining a healthy weight through proper diet and exercise. Quitting smoking and limiting alcohol consumption. Stress reduction techniques like meditation or yoga. So the idea that you might be able to be active when the medication is less likely to cause a problem. So like if you know when you're going to be active, you might take the medicine at a different time. Let's say a medicine causes problems 2 hours after you take it. So, for example, if you're usually active in the evening, you might take the medication later at night. This way, the 2-hour problem happens while you're asleep. So, an important reminder is like never change your medication without talking to your doctor first. Your doctor can help you figure out if this might work for you and how to do it safely. So you don't want to just, start doing things all crazy, okay? So definitely talk to your doctor. So we also want to treat underlying conditions. So if you are a person that is a chronic recreational user of marijuana or opioids or whatever, you want to slow down on that, because that could be part of your problem, if not the problem. You want to manage coexisting health issues like diabetes, high blood pressure, or high cholesterol. You want to consider ED medications. You want to get psychological support. If ED is causing anxiety or relationship stress, consider counseling or sex therapy, or also use natural supplements. Anytime you are given a medication, please Google that medication. For example, you want to Google that medication because you need to find out what the side effects are for that medication. So you're going to go into Google and you're going to put in what are the side effects of whatever medication it is, and put the name of the medication. Now, when you go in and you look at those side effects, you want to see there's always more than one list of side effects. So on that first page, you're going to see side effects. Look at those side effects. Then right at the bottom of that, you'll see more side effects. Go to the next side effects. There's always more side effects. Okay, so there could be side effects that are on the very last, which means the least amount of people had these side effects. Like not a lot of people, just the least amount of people. But that doesn't mean that you won't have that side effect. Also, regular sexual activity. Staying sexually active can help maintain erectile dysfunction. Healthy sleep habits. Ensure you're getting enough quality sleep, as this can impact hormone levels and overall health. Limit other substances. Avoid or limit the use of recreational drugs that may contribute to ED. So I cannot stress enough how important it is for just our overall health because sleep allows our bodies to regenerate. So sleep is very important. If you are a chronic recreational drug user, I don't care if it's marijuana, opioids, whatever it is, you need to cut back or decide which is important. Now, for medication, like talk to your doctor about your dosage, because it's possible that the dosage could be cut back. If the dosage can't be cut back, talk to your doctor about the time that you take the dosage, like to find a better time for you to take this medication. Foods to eat. Fruits and vegetables, especially those rich in nitrates and flavonoids. Whole grains, lean proteins, particularly fatty fish, nuts and seeds, legumes, healthy fats like olive oil and avocado, dark chocolates in moderation, and garlic and onions. So if you watch any of my videos, you know that our diets are most important. So look over your diet and see where you can make changes that could benefit your health. Foods to limit or avoid. Processed foods, packaged snacks, fast food, high sugar foods, sodas, candies, baked goods, excessive red meat, full fat dairy products, alcohol, especially in excess, fried foods, or foods high in sodium. So you know that in order to maintain a healthy diet, we have to look at the things that we are eating. Again, when you go shopping, it's best to shop on the outskirts of the store first. And then because all the junk and the things that are not good for us is on the inside of the aisles. So when I say on the outskirts, I mean like the produce section with fruits and vegetables. Then you have lean meats, you have your meats. Then you have your dairy. We should start on the outer portion of the store first. And then when we go in the middle, you want to take care to watch the ingredients and some of those things that you are putting in your cart, because processed foods are not good for us, period. And a lot of things that people don't even understand are processed. So if you Google processed foods, you'll get an idea. I'm going to give you a little list here. Processed foods, foods that have been changed from how they grow in nature. So foods with extra ingredients added to them. So a simple example would be like canned soups, frozen pizza, chips, soda, or packaged breads. So these are things that are processed. So we have like why do these things exist? One, they're easy to make and easier to eat. They last longer than fresh food. They often, more often than not, they taste good. So, but the things to know is that some can be less healthier than fresh foods. They might have lots of sugar, salt, or unhealthy fats. Now, but not all processed foods are bad, but it's good to eat fresh foods too. For example, a good processed food would be like a bagged salad, frozen vegetables, canned beans like low in sodium, like Greek yogurt, whole grain bread, canned tuna, um, canned salmon. These things are processed, but they're still nutritious. So we want to be careful of what we're putting in our carts when we go into the grocery store. And not saying, you know, that you can never eat them, but if you're going to eat them in moderation and try to do as healthy as you can for your body. Well, guys, this is the end of the video. I hope you guys learned something. I kind of was like a little floored by the marijuana. I don't smoke marijuana, but I know people that smoke a lot of marijuana. And it kind of makes sense to me why the younger people now, why younger men are struggling with erectile dysfunction, because I feel like a lot more of them are smoking a lot more weed now because it's legal. So that kind of makes sense to me. Write me a little note. Let me know what you think. And I will see you guys in the next video.